Hello, everybody. How are you? This is Andrea Twarowski here with Dentalelle Tutoring. Now, today I'm going to be talking to you guys about some recent experiences that I've had working in the dental office. And I thought maybe if I share these experiences with you, that will help. Because especially as a new dental assistant or a new dental hygienist, you may be wondering, well, yeah, how would you go about that situation? Like, what's the better way to go about that situation? So, and I'm not used to this, admittedly, but I had a patient the other day who was seeing me for a cleaning and checkup, and as I'm seeing him, he looks at me and he kind of goes, where's the other girl? I usually see the other girl. And, you know, I said, oh, she's no longer here with us. My name's Andrea. It is so nice to meet you. I'll be cleaning your teeth today. I hope that's okay with you. And he kind of said, it's not. I mean, he was not exactly a nice person, but he did kind of say, well, it's not okay. I always see the other girl. That's who I want to see. And he was kind of getting, you know, angry at this point. And how you handle it is this. What you may want to say, or what you may be thinking, you do not say. You know, here I'm thinking, I beg your pardon. I have 13 years experience. Shut up and let me clean your teeth. But you don't say that, right? So how you should handle it is, you should say, oh, well, my apologies. I was not aware. Well, it depends. If the new hygienist or if that previous hygienist is no longer at the office, then you can't exactly say, well, let me book you in with that hygienist again. If that hygienist is no longer working there, then what you should say is, well, my apologies. I was not aware. I am so sorry this happened, but that hygienist is no longer here. I would be happy to see you if that's okay. And then if they say, well, no, that's not okay, I would like to see the other hygienist. Then, you know, they're clearly not listening to you. So I would then say something to the effect of, well, again, I'm sorry, but they actually don't work here anymore. So even if you came back tomorrow or the next day, they won't be here. Is there a different hygienist you would like to see? And then I would be happy to rebook your appointment with that other person. You know, that's how I would handle it, but they will probably still be upset. They may even say, well, no, I like to see the other hygienist. She's not here, so I am leaving. And then they may leave the office permanently, or they may just leave the office for that afternoon, calm down, and then call back. But never, ever be rude to them, even if you want to be. Patients are not very smart sometimes, like having them keep on saying, well, I want to see that hygienist, and then you say, well, they're not here. I can't really help you with that. There's nothing that you can do about it, but always be professional and then help them as much as possible. So that situation did happen to me. I had simply said, well, this hygienist is no longer here. I am sorry, but I would be happy to book you in with somebody else, but since you are here now, I would be happy to see you. They did not want to stay. They had actually left the office and then called later saying that they have started to go to another office. Yeah, seriously, it happened. Do I take it personal? No, absolutely not, because they were just obviously having a bad day. Because if you think about it, them going to another office where that hygienist isn't either, what's the point? What's the point of them having to go through a whole new patient exam again, seen by another office by other people? And I was a very nice person, so it's not like I was rude to them and then they wanted to leave the office because they didn't like me. They hardly knew me. I had hardly talked to them. So it does happen, but don't take it personal. But again, just remember to handle it in a nice way. Now, you may have it where they are booked with you, but there is that other hygienist still working in the office, but she just may not be here today, or she's seeing another patient. In that event, it's kind of the same thing. All you pretty much say is, oh, well, my apologies. I would be happy to rebook you with that hygienist for next time, but since you are here now, I would be happy to see you. But if they still say, well, no, I don't want to see you, you know, it's nothing personal, but I don't want to see you. I want to see that other hygienist like now. Well, if she's with another patient, you can't just simply say, well, you know, she's seeing another patient. I can't just switch you over. That's not how things work. So if she is available, awesome. Do that switch if she's not seeing another patient, which is highly unlikely because usually as a hygienist, you are booked solid. Or you should say something like, well, you know what, she is here tomorrow at 11 in the afternoon, or 11 in the morning. How about we see you then? I apologize for the inconvenience, but she would be happy to see you tomorrow. And I will leave a note on your chart saying that you will only see her, because I don't see any notes here. So that's how this mistake happened, and I am sorry. You know, you could always do that, because it will happen. Trust me, where they are booked in with you, but they want to see somebody else. And then sometimes they are booked in with somebody else, but they're like, I want to see Andrea. Why am I not seeing her? You know, it does happen. Just make sure to take notes. If that person only wants to see a certain assistant, a certain hygienist, it does happen. You have your nice patients who might say, well, I prefer to see Andrea, but I mean, I'm here now, so I'll see you, you know what, sure. Or you will have the not so nice patients saying, well, I would like to see her, or else I am leaving the office right now. You know, you will have those people, but that's okay. So I hope this helped. I just thought that I would talk about my more recent experience, and that happened. But hey, look on the positive side, that if you do see a patient who will only see somebody else, you have an hour opening to have a coffee, have some water, sharpen some instruments, take notes, whatever you want to do, right? So hey, don't take it personal. It does happen. I will see you guys all in the next video.